Hello everyone, welcome to this teaching presentation video on professional supervision in helping professions. There are a few reflective exercises which I hope will help you to recollect and check whether you have learned what is expected for you from this teaching. These are the objectives that I have set for my learners who listen to this presentation. You'll be able to define what it means to have or what supervision means in different situations. What is the difference between supervision defined by dictionary and the professional organizations? You will be able to describe what are the methods, approaches and types of supervision. You'll be able to check with yourself whether you need supervision. If you need, what is the kind of supervision you want? And I expect this will help you to make a decision also for a willingness to take supervision for yourself. Let's look at the dictionary meaning of supervision. Here it's one of authority. Supervision is described as overseeing, inspective, and superintendence. So these are the words that usually threat people when they hear the word supervision. Let's go deeply into what it means. Clinical supervision is a formal professional meeting between a supervisor and a supervisee. What is the objective of this meeting? As you can see, it is a structured, confidential meeting where regularly the supervisee and the supervisor meets to discuss the progress, the difficulties, and which will help the supervisee to move on to better work with the clients. Let's also have an overview of what are the different situations where supervision training and taking supervision is helpful. All helping professions for that matter is good to get supervision. So that includes healthcare areas where physicians and nurses are trained. That includes physical health care and mental health care. It also is useful for educators who work with children, grown-ups, and professional education also. The skills can be refined and you can be a better educator when you get supervision. So now let's see what are the purposes of having clinical supervision. Identify the purposes. It's meant to protect the clients who are at the further end of the helping work. So a nurse who helps the patient, a doctor who treats the patient. So if the patient needs to get a better care, the doctor and the nurse must be efficient. So that is why training of doctors and nurses need supervision. Similarly, mental health work. A counselor or a therapist or a mentor, when they take supervision, their quality of interpersonal activity with their trainee or supervisee improves, and that ultimately helps the quality of service for the client at the further end of the chain. This is a definition for supervision given by Bernard, and in its book is published by Goodyear in the book Fundamentals of Clinical Supervision. So you can see it's an intervention provided by the expert to the less expert or the trainee person. It is evaluative, it is extends over a time, and it is prescriptive. And what are the prescriptions that a supervisee could get? Those prescriptions enhance the skills of the supervisee. For what? As you can see, the professional functioning of the person, it will also enhance the quality of the work, and it includes monitoring of the work for that purpose, and it also is a safe gatekeeper for the profession. Supervision acts as a gatekeeping function for any profession. Any profession where training doesn't have supervision, gatekeeping is less, and the professionals could be of not so good quality. This is yet another definition given by Hess. It's a quintessential process. Quintessential means it's essential, which cannot be avoided. So it has to be there. Supervision has to be there. And it's an interpersonal relationship where one person, the supervisor, meets another person, the supervisee, in confidentiality regularly to facilitate the growth of the supervisee. Let's see what are the different methods supervisors use to bring about this process of supervision. It could be done one-to-one. It could be done in a group. It could be done in a formal way and informal way. Supervision could be done in a planned manner. Sometimes it is done ad hoc, meaning as and when you see something is happening, supervision has to be done. So there are many ways supervisors practice this, and there is also systems for this. Large training systems have built-in systems of supervision also. One of these methods are being used there. Now it's a time for you to reflect. Pause the video and look at these questions and ask yourself. If you need go back, please go back to the video and check with the slides and listen what is being explained, and come back and write down your answers, which will reinforce your learning and understanding of whatever you have listened so far. These are some of the approaches that supervisors take in making supervision happen. Developmental is a very common and very commonly used approach, because supervisees in their training go through different stages. So the needs of the supervisee who is in an early stage of training is not the same as the needs of a supervisee in a later stage of training. So supervisors adapt to the stage of development of the supervisee and help them get on to the next stage. Another approach to supervision is functional. It's based on what function the supervisee is engaged in. So the focus is on enhancing that function. Yet another approach in supervision is theoretical. So actually this teach is a theoretical teach on supervision. But my purpose is to help you be capable of receiving and giving supervision. So theoretically, this session is informing you what is it all about. Similarly, in actual supervision also, certain theoretical forms are used. That is theoretical approach to supervision. There is systemic approach where multiple aspects of the work is taken into consideration. So the system has inbuilt methods of supervision. Discriminatory supervision means flexible, depending on what is happening, where it is happening. The methods, the way supervision is provided varies based on that. Competence-based supervision is something similar to developmental model, where in a group different supervisees may have different competencies. So sometimes it aims at developing all competencies for everyone, or facilitating or enhancing available competencies. It depends on the situation. Restorative supervision is one where the emotional restoration of the supervisee is given more importance. All helping professions are very demanding. They can cause a lot of emotional charging for the practitioner or the supervisee. So it's very important that their emotional health is restored so that they are fit for another episode of helping work. Technically, we refer to this as burnout. So to heal burnout and to prevent burnout is the focus of restorative supervision. Kadushin and Proctor has described the functions of supervision in two ways. I'm putting them together here. They are similar, but they use different words. You can see. The educative function of supervision is also known as formative, and it aims at developing skills and the understanding and ability of the supervisee. Whereas supportive supervision is restorative, like we discussed earlier. It's for the emotional upliftment of the supervisee. That's one function of all supervision. That's what they put it here as a function of supervision. When I use the word restorative in approaches, what I meant is that aspect of supervision is the primary approach. But here Kadushin and Proctor are trying to say that it's a very important function of every supervision. Managerial or normative function of supervision is something close to the dictionary meaning. Earlier we referred to it as gatekeeping function. So this is what makes supervision a process of power. The supervisor has some power over the supervisee here. In the sense, supervisee's work is managed, certain norms have to be practiced. So the managerial role is to check whether those norms are practiced. That actually is meant for the client to check all this, ensures that the client gets a quality service. So it's very good for all of us who are learning to be supervisors to put ourselves in the shoe of the client and understand. So if I am the client, what is the quality of my caregiver that I expect? So when I am the caregiver, I need to have that level of quality which I would expect as a client. And for that we need supervision. This slide I'm trying to compare the similarities and differences between training and supervision as well as teaching and supervision. As you can see, there are similarities as well as differences. Training is imparting skills. Supervision is much more limited. The focus is very specific. It is limited in scope. Training has a much wider scope. Many things are included there. Similarly, teaching. Teaching is imparting skills and knowledge, and it also has a gatekeeping function. It is driven by a curriculum. But supervision is also has many of these functions, but it is driven by the need of the supervisee more than the curriculum. It may be more than what is said in the curriculum sometimes. It may be less than what is said in the curriculum. It is more supervisee oriented. Now also you can see the similar differences between therapy and supervision and consultancy and supervision. There are many things common in therapy and supervision. Therapy is a psychodynamic process. Supervision is also psychodynamic, especially when it comes to mental health professions. In therapy, there is no evaluation. But in supervision, there is an evaluation of the supervisee. The therapist facilitates the self-actualization of the client. Supervisor facilitates developing skills in the supervisee. So in between there may be evaluations. It's also possible to say that supervision can be therapeutic in many instances, even though it's not therapy. Depending on the relationship between the supervisor and the supervisee and the methods used, many supervisions are therapeutic. If you look at consultation, you can see both help recipients work well. But again, consultancy is not evaluative, whereas supervision is evaluative. It is the gatekeeping function which makes it evaluative. So there is also a hierarchy involved in supervision. Please note that. Now again, time for another reflection. You can stop the video, look at these questions, and reflect for yourself the answers. It's good to write them down as well. Now let's see what are some supervisory styles and what are the factors which determines the supervisory styles. The supervisor's method of practice may influence the supervisor's style of practice. For example, if the supervisor is a cognitive behavioral therapist, those concepts and theory may be applied in supervision as well. Similarly, a TA therapist, when becomes a supervisor, transactional analysis may be used there. The supervisee may or may not be using same style, so but it is good to be aware. So also match and mismatch between age, gender, and other qualities, cultural background of the supervisor and the supervisee can affect the styles of supervision. All these are possible to be integrated. So these are being mentioned here so that it helps us to be aware of our blind spots, deaf spots, and dumb spots, both as supervisee and as supervisors, so that we can have a better match and more effective process in supervision. These are generally some concerns raised by supervisees. The power dynamics between the supervisor and the supervisee, the fear of being evaluated. The supervisee script even plays down here. So that can be helped with taking additional therapy over and above the supervision. And the supervisee may sometimes be concerned about disclosing mistakes. The supervisee could have certain concerns about the style of the supervisor, the methods of the supervisor, the competence of the supervisor. So it's good to negotiate and discuss. That's what we'll see in the next slide. How to overcome these concerns. First, the supervisee has to decide whether I need to develop my qualities. What do I really want? Do I want to excel in my profession? Do I need help? Will I be willing to accept recommendations and suggestions? Will I be willing to reflect my processes and ask for help? And be aware that you can choose your supervisor, and it can be done through a negotiation. And please always remember, supervision has to be a contractual process. So think of how you will contract, what your needs are. before making the contract for supervision. Just because somebody is a supervisor, you don't have to be their supervisor. You can choose your supervisor. Now, what are the factors that you need to remember when you contract for supervision? Be clear about the category of work. Be clear about your needs, the boundaries, and also expectations. You can share mutual expectations. The supervisor also needs to share about the mode of functioning and the style of functioning that he will be or she will be using, so that the supervisor can decide whether or not she wants to be in that. So if the supervisor doesn't say that, as a supervisor, you can ask and you can decide whether is that what I want. Of course, the ethical boundaries are very, very important. Now again, another exercise. This exercise is intended to help you reflect your theoretical learning that has happened now, and also apply it to your own self and your own needs of supervision. Pause and reflect and make your decision. Thank you. I hope this video is giving you some light on that dark interior spaces which are worried about taking supervision. I wish you all the best to choose your supervisor, to make your decisions, and to grow as excellent professionals. Thanks again.